First question I did want to ask, and it's a very straightforward question. Do you support the lawsuit right now going before the Supreme Court that could eliminate Obamacare and with it coverage for pre-existing conditions?
This is so important. Thanks for asking that question. I've said and will continue to say that I do not believe that you should pull the rug out from under people, and I don't support this move without a plan in place. We have to protect people with pre-existing conditions and keep our promises to our seniors. I don't think the ACA is perfect. It needs improvement. But my opponent has been attacking me for the last year on this while he enjoys coverage from an ACA exempt plan and doesn't have to face the problems and limitations everyday Americans do.
So, perfectly blunt, you do not support this lawsuit, then we can say unequivocally.
Again, we have to protect people with pre-existing conditions and keep our promises to seniors. And I don't support this move without a plan in place.
Okay, and there is no plan in place. So I'm going to take it, ergo, that means you don't support the lawsuit.
No.
Okay.
No. Anything, Nick, anything that would take away pre-existing condition coverage for the most vulnerable and fail to keep our promises for our seniors, I cannot support. I've said the same thing for a number of years, and I appreciate the question.
Okay, well, let me ask that then, follow up on it. President Trump has been in office for more than 3 years now. He's had a Senate majority Republicans that entire time. And they have not gotten an insurance coverage plan through to his desk for him to sign yet. And he has said now for 2 years that he has a plan ready to go and has thus far refused to show it to the public or the media. So why should voters believe Republicans and Republican candidates will have a replacement to cover pre-existing conditions in a few weeks or months when we've been waiting for literally years to see a plan?
Well, I think you have to talk to the Republicans who are in Washington right now. But there is someone who's running the Republican Party in Michigan right now you can ask. And I've said, I believe that we may need to make healthcare market more competitive and focus on patients, not drug and insurance companies. I believe that we can achieve a market-based, patient-centered system by looking at regulatory and tort reforms that lower the cost of care while increasing quality. My opponent's plan is to keep ACA and cave to the socialist agenda to pass Medicare for all. He does this even though he knows the ACA system has problems and has removed himself from any kind of ACA plan. So I think the easiest and most succinct way to do this is to keep the parts of Obamacare that work and fix the parts that don't. I think that is probably the most straightforward way to go, and it requires people to work together and get things done. And Senator Peters, quite frankly, is proving his inability or unwillingness to do that.
What details can you give me? How do you cover this high-risk pool of people, frankly sick people, if you get rid of the mandate and where people aren't paying it? How do you actually get money for those people to pay for their coverage?
Well, I think that the way you get money is by having healthier Americans. I think that we've been hyper-fixated on healthcare because it's so important, but we also need to have complementary regulations that support wellness, mental health, physical health, specifically around nutrition and fitness, addressing food deserts in rural and urban environments, and putting the plan in place so that Americans can be more healthy. That will drive down prices. But also I believe that through tort and regulatory reform and having a legislative requirement, working with industry leaders to innovate, I believe that through tort and regulatory reform, we can increase competition, we can increase transparency, we can lower cost, and we can increase quality of care. I believe that having a market-based approach that must take care of people who are most vulnerable can be taken care of on a legislative requirement. And that should be something that our legislators take care of, and something that I'll be looking forward to working on when I get to the Senate.
I don't think anyone disagrees with you that we need a healthier society. America is the fattest, most diabetic country on the planet. But that isn't going to get fixed in December if the ACA gets struck down in November. What do you do if you are a senator-elect or going into your first term as a senator? What do you say to pregnant mothers who suddenly have a pre-existing condition the moment the ACA gets struck down?
The first thing I would say is I have a son who has a pre-existing condition, and I understand firsthand how important it is to take care of our family members and protect people who have pre-existing conditions. I also have employees who I understand how important it is to make sure that they can take care of their families. And I work very, very hard to keep them on a healthcare plan that they have chosen that works for them, and making sure that that we take care of people. I've actually have my employees on the same healthcare plan that my family is on. That's very important. Again, as right now, and as a senator-elect, I will not be in a position until next year and for the next 6 years to help. But again, like I said before, I will not support any plan that pulls the rug out from under people, that will leave that pregnant woman, that will leave our grandparents, that will leave the most vulnerable among us without support. We must have a plan in place that covers people who have pre-existing conditions and keeps our promises to our seniors, and working together with the people who are in Washington to provide better options, more choice, more transparency, more competition, I think is the way to go. I believe that the decision-making and the benefit should go to the people, not to the federal government and insurance companies. And Senator Peters saying that Medicare for all is the way that we need to go, I think is the wrong answer.
You said a moment ago, and I know you've said variations of this before, that we need to keep the parts of Obamacare that work, get rid of the ones that don't. What parts of Obamacare work for you? Flat out.
Another great question. The biggest part that works is coverage for pre-existing conditions. Another one that works is the ability for ACA to work in concert with private healthcare. And when Senator Peters says that Medicare for all is the way that we're going to go, what he's saying is that millions of Michiganders who rely on private healthcare, that's going to be made illegal. What he's saying to our seniors, over 95% of whom require Medicare or rely on Medicare, may be put in the back of the line for others. I believe that, again, having a market-based, patient-centered approach that must cover pre-existing conditions through a legislative mandate that Senator Peters could come up with if he cared enough about it, if he understood enough about things in the real world to come up with something rather than just voting party line. And brushing off questions from the media about his health care as recently as a few months ago. And the fact that he's getting away with it, I think is kind of a disservice to people in the state of Michigan. But I think that, again, moving forward with a plan that benefits the most amount of Michiganders is absolutely the way we need to go. And the biggest part of Obamacare that works is covering pre-existing conditions, and also coexisting with private healthcare, which is so essential for so many Michiganders.
Obviously, the part that most people like is the pre-existing conditions, and we've seen Obamacare get more popular in the polls since its inception a decade ago now, and it's now got plurality support above 50%. But that most liked part is the most expensive part, and you do say a market-based approach, which is a good, strong, conservative Republican idea, but the mechanisms by which we do this have not been explained. Can you explain what that mechanism looks like?
In detail, how about this? People suffer in environments where there are monopolies and lack of transparency. And right now with drug companies, there's a lack of transparency on how they're charging Americans more than what they're charging overseas. Right now, in terms of pricing with hospitals, there's no transparency. There's no accountability with these hospitals and insurance companies. And through legislative mandate, we can give people information to make the best decisions for what they want to do with their families, and not leaving that decision to bureaucrats or to insurers or to hospitals. But just like anything else, when you go buy a car, you know what the price is going to be. When you go to buy a cheeseburger, you know what's in it. Because there are legislative requirements saying that there needs to be a label on that so I know what I'm putting in my body. So why isn't there a legislative requirement from folks like Senator Peters in saying that before I make a healthcare decision, I should be able to have the ability to have my healthcare be my own and be able to shop and have more options. And through that competition, I make the drug companies and I make the hospitals compete for me and my dollars, because I want to go to the area where I'm going to have the most choice, the highest quality of care, and the lowest cost. And you see it works in industries across the world. But again, we have to have a legislative mandate that must cover folks with pre-existing conditions and must keep our seniors protected and safe.
Okay, I want to circle back to one thing and then I'll move on with this. You said when I asked about the lawsuit to undo the ACA before the Supreme Court, you don't support anything that pulls the rug out from under people.
Yes.
So in that aspect, if this goes through, has President Trump and the Republicans pulled the rug out from under people? By the way you're describing it, it sounds like that's what you're saying, that the Republicans, President Trump, will have pulled the rug out from seniors and other people who depend on the ACA.
So you're talking to me, and I can speak for myself, not President Trump or any other Republican. And
I'm asking your opinion about them.
Well, and my opinion on this is no one owns me, and I'm going to take care of people in the state of Michigan the same way I've taken care of the health care of the people who rely on me in my business. I am going to be focusing on what Michiganders need to take care of people with pre-existing conditions and make sure we take care of our seniors. That's what I've done my entire professional career, and that's what I'll continue to do over the next 6 years.
I get that, but are they pulling the rug out from other people? It's a very straightforward question.
But again, it is a straightforward question. I'm giving you a straightforward answer. You should ask them their opinion, and my opinion is I'm not owned by anybody, not any person, not any party. This is where I stand for the people of the state of Michigan, and it's firmly on protecting pre-existing conditions and making sure we keep our promises to our seniors. That is my answer, sir.
Okay. Moving on, Supreme Court. You're obviously not in a position to vote on the current nominee, but I want to ask you your philosophy based on something that another senator sitting right now, Senator Hawley, has said. He basically believes now that any Supreme Court nominee needs to pass the litmus test, that they believe Roe v. Wade was wrongly decided and they would vote to overturn it. If you wind up winning this election, you will clearly be voting on future Supreme Court nominees. Do you agree with that litmus test that future nominees have to agree that Roe v. Wade was wrongly decided?
The only litmus test I have is that the person who's being approved by the Senate it respects separation of powers and will uphold the Constitution of the United States by interpreting the law, a textualist jurist that will dispassionately and impartially interpret the law, that will stay out of my lane as a senator and allow the legislature to make the law, while again, the Supreme Court interprets the law. I believe that in contrast to my opponent, who has proven himself to be an entrenched partisan who rejected the nominee before she was even named, I believe that Amy Coney Barrett is a highly qualified and well-respected legal mind with a brilliant career. And I think that it's fair that she receive a respectful hearing. I call on my opponent to do something he's never done and assess this nominee based on her merits, not on who nominates them. I would be committed now and in the future to a fair constitutional process, and the Constitution is clear on what happens when there's a vacancy in this court. And so I would just abide by the Constitution. People are pointing at Harry Reid and Mitch McConnell from what they've done in the past. And I, quite frankly, am sick and tired of the partisan games. We need to get back to the same type of class that Republicans exhibited back when the late Ruth Bader Ginsburg saw with, I believe she got like 96 votes from the Senate. So
what about the class, in just using your words, that Republicans showed Merrick Garland 4 years ago?
Well, you'd have to ask them again. 4 years ago,
you were just very quick, however, to say what they should do right now. Mm-hmm. Not me ask them. You were very quick to say what they should do now, the Democrats, not me ask them. So I'm asking you now about Republicans, not me asking them. You were quick to give your opinion about what the Democrats should do. Now I'm asking your opinion about what the Republicans should do.
All right. Well, I'll say that the same thing, that Republicans now are going back on what they said 4 years ago, just like what Gary Peters is going back on what he said 4 years ago. Again, to break this tie, we need to get back to the Constitution, dispense with the partisan bullcrap, and make sure that we uphold our oath to put the Constitution first, not political convenience. So I think that both parties have failed, and I've said that many times, especially on the campaign trail, and this is just one of them. The people of this country are sick of the partisanship. It's tearing us apart. Get back to the Constitution, regardless of what Reid did, regardless of what McConnell did. I'm running because I believe that Michigan deserves better than this partisan bickering. Let's get this behind us. Let's abide by the Constitution. Let's abide by our oath, and let's work on things that will heal this nation.
Older question regarding healthcare, and I apologize. I don't know how much time you have, Mr. James. We didn't really set up a. If you're running out of time, please let me know. I don't know what you're crunched for right now.
Yeah,
Well,
Nick,
yeah.
I think we're coming up on, I'd set aside time for 15 minutes in John's schedule, and I let it run
Gotcha.
a little over because we started late, so.
Gotcha. Last question then, and I will leave it to you then. Anything healthcare related? I was going to ask about prescription drugs real quick. Is there anything of specific import that you want to bring up that we can talk about briefly before I let you out?
I would say, again, my opponent is getting a free ride on this healthcare thing. He's not being asked about why he's on an exempted ACA plan. He's not being asked about the money that he's gotten from pharmaceutical drug companies. He's not being asked about some of his positions on Medicare for all being the way it needs to go, and then behind closed doors saying that ACA needs to be fixed while he's attacking me. He's not being asked about those things. And honestly, Nick, you're among the first people I've talked to in the entire state that gives a straight up interview on these things, and I appreciate that. So yeah, I appreciate this because people need to make these decisions, and we call on Senator Peters' ACA plan before the Affordable Care Act and is closed to new enrollees. We don't know the details of this plan, and Senator Peters has avoided sharing the details of his plan. And I think that those are things that Michiganders deserve to know, and he should be more transparent with us.
Mr. James, I appreciate the kind words, and if I just have one follow-up to that, and then I'll let you go. As far as the healthcare that your opponent is on, he did earn that healthcare coverage plan he's on with his service in public office. Mm-hmm. Former military like yourself earned their coverage plans that they are on oftentimes for life. I know you may not agree with it, but is there anything illegal about the coverage plan that he is on? Did he not earn that coverage plan?
Well, that's the thing. It's an essential part of leadership that we learned at West Point is leaders eat last. There are certain areas in leadership where you're called to set a good example. And I think part of setting a good example is living under the rules and regulations that you force other people under. I think when leaders eat last, they best understand how the people living back in their state are living, the things they're going through, because Senator Peters is in a better position to fix healthcare than just about 10 million people in the state of Michigan. And the fact that he is detached from the same plan that he supports does not allow him to do what is right for the people of the state of Michigan. I believe that me being on the same healthcare insurance plan that my people are on, I think that puts me in a position to know what they feel. For instance, when my son, who has a pre-existing condition and asthma, when he had an attack and we had to take him to the hospital, I was being attacked by the Democratic Party with an ad that had a little girl with asthma. I know that my employees are on a good plan because I was able to get my child looked after. And that's something that's important to know. Senator Peters being detached from the rules that he's imposing on the rest of us, I believe is wrong. And I believe that though he may champion one thing, I think it's kind of hypocritical that he's not eating his cooking, essentially.